It's another sign of fall that we're all hearing and seeing more about Medicare in the annual open enrollment period. Whether you're reviewing your current Medicare plan or are evaluating coverage options for the first time, the State Health Insurance Assistance Program is here to help with free, unbiased health insurance information. And that includes our conversation on this edition of Primetime. And good evening, I'm Bruce Haines. With us this week are Paul Thieroff and Art Jackson, two of the more than 400 volunteers with the State Health Insurance Assistance Program, or SHIP. They are counselors across Indiana who are ready to help seniors evaluate which Medicare supplement programs are right for them. So our guests are here to help you, so you can join in with questions, comments. The number's right there on the screen as we welcome Paul and Art back to the studios.
Yeah,
good evening, gentlemen.
Thank you, Bruce.
You know, one easy question, probably with a difficult answer, perhaps, is the one that starts with, how does a person decide which road to go down when you say, okay, it's time to join Medicare? I have traditional Medicare, I have Medicare Advantage. How do I GPS myself from this intersection? Art, let me start with you.
Well, as you mentioned, there's so many options now and so many difference in plans. So what we do, we encourage individuals to first want to make sure their doctor, all their professionals are in those plans, in that particular plan they want to choose. For instance, they want to make sure their medication is in a plan. These are individuals that looking at Medicare Advantage plan. And if they're just with the original Medicare, they still have to have a Part D plan. And same thing with the Part D plan. You want to make sure all of your medication are being covered in that Part D plan, because if not, you'll be having some surprises.
There is a lot of marketing that goes around the information, understandably, in America today about now. Paul, how do we sift it, to help understand what my roadmap might want to be, Advantage or the traditional approach?
I've always looked at it as the matter of whether to choose, let's say, a Medicare supplement versus a Medicare Advantage plan is sometimes based on your budget, because the supplement plans will charge you more for premiums, but they will pay more. So it can be a trade-off as to how your budget ends up, and your health could be a factor on that. You may decide that you're better off with one versus the other if based on your health and your tolerance for risk, let's call it. A supplement will cover pretty much what it says it will cover. If it says it covers Part B deductibles and Part A deductibles and copays, then you can be assured that those are paid. But the one fail-safe that the Medicare Advantage plan has is that they do have coverage limits. You can only pay so many dollars in the course of a year, and then you stop paying because you've hit the coverage limit. So there is no one answer for that.
This is another sign of fall. Many mailboxes around the Northeast Indiana, Northwest Ohio, Southern Michigan area have been receiving the cover page of this publication. It is a bestseller about now.
Yes.
Home delivered without any. You can really get lost in the pages of this, but it's a tactile way of, I guess, trying to, like a textbook, find a way through things.
Yes, it is. Practically anything you want to know about Medicare is in that book. If an individual have problems dissecting what he or she sees, they always can give us a call, and we'll help them.
What a segue. That's awesome. Go ahead.
And one nice thing about the Medicare book is that if you have Medicare A and B, and that's what all you have, you can go to the Part B section of Medicare and You, and you can look up to see, for example, how often you can get a colonoscopy, for example, and you can look to see what coverage there is available, and perhaps there are some restrictions. So that's one nice advantage. And that part of it, what I described on Medicare Part B cost, is toward the front of the book. I can give you a page number, but it is there. And if you need help, please give us a call. We'll be glad to walk you through it.
In a sense, it is kind of like going to class, but in a good way, because you will always pass when you stop by the classroom that's known as SHIP. And here in our viewing area, there are several counseling sites available, and we'll have that information up on the screen so that appointments can be made, and you don't have to wait for the enrollment period to pick up the phone and call.
That's correct. Anyone that need assistance, they're thinking about making a change, or if they're just new to Medicare, give us a call to that number, 373-7952. And we would rather have everyone come on an appointment so there won't be 2 or 3 people trying to get in at the same time. But we are open at the site on Carew Street. We are open Tuesdays and Wednesdays. So we'd be glad for anyone to give us a call, and we'll return that call and make an appointment for you.
Another point to underscore as well is this is free.
Oh, yes.
And it is statewide, and you are also Switzerland. You are neutral as to whether one goes down one path or another path, right?
Yeah, we don't sell anything. We try to give the best advice we can based on the individual's needs, and you'd be surprised how many different varieties of needs there are out there. We try to tailor our presentation to the individual based on what their specific case, and hopefully we can give them good advice and lead them in the right direction without telling them, here's what you need to do and here's where you sign. And we don't sell anything, we just provide advice.
And the best thing folks are bringing with them, maybe the handbook, but they're just bringing themselves and what questions they may have written down, I suppose.
Yes, one thing we tell them, make sure they bring a list of their medication. Yes. Because if you go from one plan to another one, maybe one plan will cover a particular medication, but the other one doesn't. So that person have to make sure they bring the medication so we can give them all the best information available so they can make a decision.
Which is a great lead into one of the major change areas going into 2025 related to Medicare changes, and we'll start with the prescription drug one. This is big information here, I believe it is, for what's going on there.
Yeah, the Inflammation Reduction Act included this $2,000 limit on prescription drug coverage for next year, and the $2,000 represents the maximum that you can pay in the form of deductibles and copays for next year. It does not include the premiums, but deductibles and copays are capped at $2,000. And after we show on there on the screen, you see a maximum deductible of $590. The plans can really put whatever number they want to there as long as it's less than $590. And I've seen that quite commonly now that I've had a chance to look at the plans. And also the co-pays subsequent to working your way through the deductible don't have to be 25% exactly, but it has to average out to that number. So the key number on that third paragraph is the $2,000 number. It's if you do the math on that $6,230 that's mentioned, and factor in the first $590 comes out of your pocket, and the remainder is at 25%, and add that together, it's $2,000. But your results will be different than that. And as a result, Bruce's favorite coverage gap or donut hole is gone. It's history, and this is no longer a part of our vocabulary anymore.
That's a very interesting take. And I believe we have info on this as well, that this Medicare supplement, the additional changes that we have to share, for that to disappear, that was always a tough one to try to explain, and why they called it the donut hole and all that kind of thing. So that is no longer. I was struck by this information from AARP that people with Medicare will have access to an average of 15 standalone Part D plans in their area. And I think for a Medicare Advantage plan, it's like 34 different providers or plans, or 40, in the low 40s. I saw another figure. And this is the counseling in Medicare counseling. It's like, how do you line them all up and then try to, pick a number from 1 to 10? How do you do that?
And these choices is for Allen County, because DeKalb County may have more, may have less, because not all counties carry everything. So one thing about, I'm going to back up a little bit, on drug costs, excuse me. Now, say a person, they got to meet that $590 maximum deductible. Okay, maybe they don't have the money. It's January, they need their medication. So now they can call and have a level, have that spread it out the whole year, all that cost of that medication, everything. And it's going to vary from month to month, all depending on what medication you use. But you're not worried about you got to put down so much money to get your medication. Once you sign on a plan, that's going to be lower, so you can be able to get your medication whenever you need it.
That is worth underscoring, absolutely.
Yes. And the way that works is that once you sign up for this Medicare prescription payment plan, you don't pay anything at the pharmacy when you pick up your meds.
That's correct.
And that your drug plan pays the pharmacy. And the drug plan then in turn, they will bill you monthly for your 1/12 or 1/11 of that, your portion. Now the first month is not as I just described, but once you get past that, then it's simply the balance that you owe the insurance company divided by the number of months left in the year. Mm-hmm. And so especially if you have drug costs that are heavy in the first part of the year, this may be a good plan for you. Mm-hmm. If it's optional.
If you're a visual learner like I am, you'll appreciate this as we would move ahead to the image regarding Medicare choices. It's a flow chart where you'll see where the Medicare Part D drug plan fits in, or the Medicare Advantage plan. Walk us through, gentlemen, what we're seeing here on the screen related to the comparing and contrasting of Medicare and Medicare Advantage.
Okay, everyone has Medicare. Once they reach 65, they're on the Medicare Part A. Now, for individuals, they have to decide whether they want to go with the original Medicare or Medicare Advantage plan. The original Medicare, you have to have a Part D, and it's necessary to have a Medicare supplement. It's not mandatory, but I would suggest someone goes that route, have a Medicare supplement, because that picks up most of the money that you are responsible for. Because, Medicare, original Medicare is 80-20. Medicare pays 80, the individual is responsible for 20. And all depending on what plan, supplement you choose, they'll pick up that 20%. Okay. Now, if you go the other route, you say, well, I want a Medicare Advantage plan because they have more options like vision, hearing, which Medicare doesn't cover. So you go with Medicare Advantage plan, and one positive thing about Medicare Advantage most of them include a drug plan. But you cannot have a supplement with the Medicare Advantage plan. But the good thing, you have a maximum out-of-pocket that you're going to pay for all of your health care needs during the year. It might be, say if you go in the hospital, you might, say for instance, you have a procedure was $100,000. Under original Medicare, you're responsible for $20,000 unless you have a Medicare supplement. But Medicare Advantage plan, the same procedure, $100,000, well, your maximum out-of-pocket may be only $3,000 or $4,000, and that's all you have to pay. So that's why some people choose a Medicare Advantage plan over original Medicare.
I like the explanation, and I'm particularly grateful for this next image because it walks us through a checklist of what is probably, again, another way through the evaluation process through open enrollment in particular, and there is at least a reasonable amount of time for that. Let's put the checklist up. The open enrollment period, you see the dates there, October 15th to the 7th of December, so we're right there before us. So different things going on, and probably job one is to let your primary care provider know that you're getting ready to explore all this.
Yeah, and it's always a good idea to make sure that your primary care doctor, all your healthcare providers are in the network of the plan that you're choosing or considering. And make sure that your dentist is part of that equation, because Medicare Advantage plans typically will cover dental. So that's part of the research that you'll be wanting to do beforehand. You'll be wanting to look for a plan with low copay maximums. And remember that if you go outside of the network, the copay maximum jumps up to as high as I've seen, I think $14,000 this year, whereas typically it's more $10,000 or under. Mm-hmm. It depends on the plan you choose. Going with it, drilling into dental, no pun intended there, you'll be looking at what is that plan's coverage for the non-routine items, the costly items such as bridges and crowns and extractions, and see if your plan covers it, at what level, and what is their copay maximum that they all seem to impose. And if you travel, take a look at what is that plan's policy. If you need non-emergency care out of state, you'll be wanting to have that covered by the plan you choose. And
and I also understand if you travel abroad, that's a whole different conversation altogether, right?
Whole different conversation altogether, and there is some coverage. If you have a Medicare supplement, they do provide some coverage, but beyond that, it's another matter altogether. Yeah. Exactly.
One thing I would like to be sure we include is the information regarding low-income assistance. This is particularly valuable because it needs to be sure that it is a service that is as inclusive as possible.
Right. I think many people are accustomed to Medicaid and what they can receive, but there are other plans, the Medicare Savings Plan. Those are planned if you fall under a certain income level and your asset is lower. You qualify for some of those plans, like QMB, the Qualified Medicare Beneficiary. And there are some great benefits for individuals. So if a person think they qualify for those plans, give us a call. We'll look at their monthly income and also their assets. And if it falls in there, they may become a member of QMB. Mm-hmm. And QMB offer a lot They have many individuals with QMB. They don't have to pay anything. They get most of their medicine free, and some get this card for they can purchase other things beside medicine. They can go to the grocery store. They can pay a lot of items, get a lot of items that they probably wouldn't be able to get because their income wouldn't allow them.
Right.
So for individuals, just because you're not on Medicaid, that doesn't say you don't qualify for other benefits. The government has done a great job trying to help everyone with low income, because even though we see people, we don't know their income, but they have to let us know. Then we'll provide the necessary service so they can get qualified.
I was thinking of a point that you had raised, Paul, earlier too, building on what Art is saying, that sometimes the question comes up, am I allowed to use a drug discount program instead of my Medicare Part D plan? And the answer turned out to be?
Yes, you
can use both.
Yeah, you have that option of deciding which card, in effect, to give to the pharmacist at the time. And sometimes, in my own personal experience, a drug discount plan is less expensive than the drug plan that I have. Mm-hmm. So it's having that option is a good opportunity to save money.
Yeah. Mm-hmm. We had another question that had come in before our show here, which said that if a person chooses a Medicare supplement plan, can this individual enroll in a Medicare Advantage plan and keep the supplement?
No. If you have a supplement, then you decide during the open enrollment period you want to go to a Medicare Advantage plan, you're going to lose that supplement.
Okay.
You cannot have both. You either got to have original Medicare with the supplement or a Medicare Advantage plan.
So around this time of year, to kind of get to a summation sort of question, if someone feels comfortable, and that may be the key thing, they feel comfortable with what they have right now, why would someone wish to change their coverage and use this period to jar their feelings of comfort based on what they already have? Art, or Paul?
Yeah, that's a good question, and some people do fall into that trap of just saying, well, I made that decision last year, it's going to be good for a while. And there have been changes to the Medicare plans. I don't know how that person's, their particular drugs, for example, how they will be priced next year, or if their drug plan will even cover all of their medications that they take. So that's a consideration that the individual have to give. Is everything covered? As well as going through that same Medicare Advantage checklist, you can go through that checklist almost for even if you're not on an Advantage plan, you can look at that as a way to make sure that you're covered. Mm-hmm. So that I guess I could liken it to buying a homeowner's insurance and making sure that your house is covered just in case.
Yeah, that's right. Anything you want to add, Art, on that one?
Well, we encourage everyone, don't change just to be changing. Oftentimes, a person might be talking to a friend and they might have a way they explain it to you, that plan is better than mine. But don't just jump on a plan and change because someone else gave you some, it's okay. Because you may be sorry. But the key is, you don't have to make a change. If you're satisfied with your plan, you don't have to do anything. Some people have been on the same plan for 2 or 3 years, 4 years. Mm-hmm. It's not mandatory that you have to change. If you're satisfied, if it ain't broke, don't try to fix it.
That's right. On the other hand, you don't know how long the smoke detector battery has been up there in that ceiling fixture, so sometimes it's good to check.
Yeah.
And it's good to just put the new one in every fall. It's good to review your information regarding Medicare coverage about this time of year as well. Here is how you can find more information about where the State Health Insurance Assistance Program counselor is closest to you. There is the phone number, 373-7952. And, of course, a website to go with that, fortwayneship.com. Gentlemen, welcome to your 5th season of the year. There's summer, fall, winter, spring, and Medicare.
Okay.
Yes, indeed.
You've done it for a long time. Best of luck for the weeks ahead. Thank you so much for being with us.
Thank you, Bruce. Thank you.
Paul Thieroff and Art Jackson, ship counselors, here to assist you in the coming days. And for all of us with Primetime, I'm Bruce Haines. Thank you for allowing us to be a part of this day with you. And we'll see you again next week. Good night.
Golden Years Homestead, a faith-based, continuing care retirement community. Information at goldenyearshome.org. 89.1 WBOI delivers the story behind the story. Fact-based local, state, and national news for Northeast Indiana. On the radio at WBOI.org and on the mobile app. It's WBOI for the how and the why.